Interim of Oakland County has developed a school nurse program for the 21st century. No longer is the school nurse the person responsible to do head lice checks, to pass out medication, to provide ice for students who might be injured on the playground, and many other incidental items. Instead, the school nurses are direct caregivers, they're educators, they're counselors, they're consultants and case managers. The school nurse is primarily responsible for coordinating and implementing the health care of students according to the medical order from their own physicians.
My day is pretty busy. I have right now a total of about 5 students. I have a student that is a continuous bolus feeding throughout the day. I have another student who has cerebral palsy, and so he is a seizure precaution, as well as he is an irrigation tube for bowel regimen. And then I have 2 other students that are seizure precautions as well. And then my last student is a catheterization twice a day. I try to help out with the special needs kids that are mainstreamed. I may go into the general education setting to help out with my special needs kids as they are mainstreamed. And then really I'm just there to be a help. I really feel like with my particular classrooms that the teacher is really great about getting the whole team involved. We're all on the same page. We all are consistent. We're structured on how we are going to, intervene when it comes to the behaviors of the student. To be able to bring a special needs student into the school setting is an amazing experience, and for them to be able to feel as normal as possible by being in a school setting is an amazing feeling. Nursing, to be in the school setting, was something I didn't even know existed. And to know that there is a place for me as a nurse in the school setting is such an honor that I get to be a part of.
The role of the consultant for the 21st century nurse is necessary to support the needs of school staff and parents. The most obvious situation where consulting is required in the school setting is with the construction of the health plan, or as we call it, the plan of care. The plan of care is an interpretation of the physician order, which is intended to describe the medical interventions to resolve the student having difficulty breathing, experiencing anaphylaxis, managing diabetes and seizures, and to support students who have been diagnosed with seizure activity. Having a plan of care assists school staff when developing accommodations for 504 plans, specifying interventions necessary to execute IEPs, and to generally intervene on behalf of students in the school setting. The school nurse also consults with school staff to identify and conduct health and wellness trainings. In today's environment, these consulting services are not salaried. Instead, the services are reimbursed as services rendered, resulting in significant cost savings to the district.
Well, I'm an emergency medical technician. I've been an EMT for this will be my 6th year. I worked in a hospital for 4 years previous to that, and I have been on an ambulance for the last 2, and this will be my 3rd school year with the school district. Well, I worked in the pediatric unit for a while, and then I seen an opening to work with the kids in the school district, so I thought that'd be a good opportunity to give back with children. Well, I take all the kids who have needs like diabetes, seizures, lots of different things. So one of the kids has spina bifida, and I just take care of their daily needs. So if they need insulin, I administer them insulin, manage their blood sugar, make sure it's not too high, make sure it's not too low, and make sure that any of the kids who take daily medicine, I give that to them as well. I like being able to see the kids every single day and make sure that they're, that medical professionals taking care of their need, whether it's diabetes or seizures and stuff. And I like being there in case anything happens, because sometimes they can get there faster than an ambulance, so it works out good.
In addition to consulting, nurses provide direct care. It is often necessary for licensed professional nurses to perform skilled interventions for students needing airway management, such as ventilation support. They may also be needed for catheterization and for tube feedings. Nurses working in schools today are supervisors for health aides working in the school setting as well. Health aides are medically trained paraprofessionals to support the non-skilled medical needs to execute the plan of care, as well as performing individual and instrumental activities of daily living. Those are nutrition, elimination, hydration, behavioral assistance, and other educational support services as assigned. The recommendation is to replace one paraprofessional at a school with a medically trained health aide. The health aide is responsible for performing the daily medical interventions for all the identified students, in addition to supporting educational needs as assigned. Utilizing a health aide instead of having a licensed nurse in a school allows administrators to provide appropriate medical intervention in a more cost-effective manner without compromising the medical interventions required.
As elementary principal, I grew more and more concerned over the years with young children entering our schools for the first time and not having a medical plan to concretely guide us as school staff as to what the best practice is for whatever they were coming to us with needs. We always had great parent advocates, and we had a staff who was willing and committed to meet the needs of children. However, it was becoming quite muddy, especially with the rise at the time with diabetes, and all good people with great intentions, but very differing input on what might be best for a child. So as a principal, I really was seeking input and clear guidance, and I knew it needed to be objective and not from school staff nor from families who were always great to work with. But we were looking for the medical guidance that gave us the assurance that each individual child's needs were being met to the individual requirement of what they came to us in need of. Another great advantage is that it's empowered our teachers to direct instruct in a more efficient manner. Yes, there is behind-the-scenes collaboration time and ongoing communication to ensure that each understand their role in partnering, having a health care provider either in their school or in their classroom. Another great advantage is that while we continue to use paraeducators in Huron Valley, it's building their capacity and their confidence in seeing how other healthcare providers can teach, can model, and can collaborate within the same environment without the fear of replacing their role. The relationship between Huron Valley Schools and Interim Healthcare has become an asset for our continuum of services. The reliability and accountability from Interim Healthcare has developed a partnership whereby they are an equal member of our Huron Valley Schools team.